Hey everyone, welcome back to my channel. It's Dr. Alessandro. Thank you for joining me. Please like and subscribe. And in this video, I'm going to be talking about dental hygienists and how critical they are to the dental team. So dental hygienists are a really important part of a dental practice and a dental team. They do so much for us and I appreciate everything they do. Recently though, there was one particular person, a dental lobbyist from somewhere, some state, who made some comments that, again, we can publicly attribute them to this state dental lobbyist. But what he said was that dental hygienists really don't have much beyond 2-year training, and that all they do is scrape teeth or clean teeth with sharp little instruments. Now, all I can say is this: if these comments were indeed made by this dental lobbyist, then they were demeaning, degrading, very unfair, and quite frankly, inexcusable. So this dental lobbyist really ought to have thought carefully before speaking and saying those things. Dental hygienists are extremely well trained. They're very highly trained individuals who have spent 2 years in dental hygiene school, but they can do education beyond that, by the way, just in case this dental lobbyist didn't know. But they did an intense 2 years of training. And in those 2 years, they've learned a lot of different subjects. I can tell you that they've learned a lot because I edited the dental decks cards. So if you hygienists are watching, your dental deck cards from 2012, 2013, I was editing them. So I know you all learned a lot of stuff that dental students in the first 2 years of dental school learned, because the cards there's a lot of overlap. I can tell you that immediately. So you folks learned a lot. There's a lot of stuff that you had to learn. So good on you for doing that. Not only that, but when it comes to being a part of the dental practice, a very integral, critical part of the dental practice, dental hygienists are typically, aside from the front desk, they're the first to welcome patients in, whether they be new or returning. So they're the first to welcome them in, to bring them back into the treatment rooms, and to help make them feel at ease. At least try to. Make them feel more relaxed, more calm. And so those are really, really important things, because in a lot of cases, visiting the dentist is, well, at least it provides some degree of nervousness for folks. And in many cases, a visit to the dentist can be nerve-wracking or even terrifying. So to have a great dental hygienist really calm a patient down, soothe a patient, and make them feel better is an extremely important thing. And so many of you do that. And I appreciate that for all you all dental hygienists who do that. I really appreciate it. So that's one thing that they do that's really, really absolutely fundamentally important. Another thing that they do is they go over patients' health histories, and they review the health histories, and they can flag stuff in case there are problems, any kind of metabolic disease like diabetes, cancer history, surgical history, things along those lines. Really important stuff. They certainly make a note of that and let the dentist know when he or she comes in for the examination. They're the first to really take a look. They do an oral cancer screening pretty much in every case, and they take a look in the mouth. And if there's something that's abnormal, they'll point it out to the dentist, and that's really, really important. So they'll let the dentist know, hey, why don't you take a look at this, doc? This is important. There might be something that's not quite right in this such and such a spot. They're the first to take a look at the overall gum health of the patient. So they'll be assessing the gum health and seeing if there are problems or not. They can't diagnose, but they can certainly make assessments based on important measurements that they make and relay that information to the dentist. Not only that, they're looking at the teeth, of course, and for any broken teeth, any signs of cavities. Again, they don't diagnose, but they can certainly help clue a dentist in on problems. They'll also take x-rays, radiographs, and they'll be taking a look at those, and they can, while again, they can't diagnose, they do have some interpretive skills, and so they can let a dentist know, I suspect there might be something going on here or there. So again, they help the dentist clue the patient in, clue the dentist in on patient needs. They also talk with the patient during the visit. So while they are doing their cleanings with sharp instruments, they are talking with the patient, getting to know the patient, getting to know maybe what the patient wants or needs as far as care is concerned, or what the patient can afford, or answering questions that the patients might have. So again, these are all super important things. And yes, while they're cleaning, they are using their instruments, but they're not just using sharp little instruments in their hands. They're using ultrasonic instruments. Okay? They're using prophy jets. They're using prophy cups. They're using medicaments in some cases, if permitted by the state. They use medicaments such as, well, I've heard of periochip. There are others, basically antimicrobial agents under the gum to help reduce infection, reduce inflammation, help get the patient's gum and bone back to health. So they do so much. Arrestin, for example, is another one. They do so much more. They can even get patients numb in some states, depending on the state board's permission or not of this type of procedure. So they can even get patients numb for deeper cleanings. So dental hygienists are versatile, and they're a critical part of our dental team. So to say degrading or demeaning things is really, really inappropriate and is uncalled for. So dental hygienists, I want to thank you all because this is being filmed at the end of October, and you all do a tremendous job. I'm blessed and lucky to have an outstanding, exceptional team of hygienists in my practice, and to have worked with so many in the past, from when I was on active duty until now. So I'm lucky. There have been a great group of people, and I appreciate everything they do because they do hard work. They really do. Day in, day out, they do hard work. And they certainly should be appreciated for everything that they do. So again, thank you, dental hygienists, for doing an exceptional job. Keep up the good work, and I know I appreciate you, and many other practitioners really appreciate you, and that's it. So thank you so much for joining me in this video, and I hope you're all staying well and healthy.